The first is Dr. Dinh, Assistant Professor of Medicine. He is one of the gynecology oncologists in the GYN surgery department. He's also the fellowship director of the minimally invasive GYN surgery. He's got 2 talks, one on HPV update as well as prevention of ovarian cancer. And then the other speaker is Dr. Paul Pettit, another assistant professor of medicine. He is one of the urogynecologists. He's been with Mayo Clinic since it opened back in 1986. Has been doing great work since then. They're going to be probably swapping their talks in and out there, and it's not in exact order, it's on the sheet. But first up is Dr. Dinh to give us an update on HPV. Dr. Dinh.
Thank you, Tom. And I know that you've had a talk about HPV earlier today, so I've been warned not to repeat the previous lecture's information. So I have no disclosures. I wish I did, but I have no relevant financial relationships. I would not be talking about any off-label things. So let's talk originally just to set the stage about the epidemiology of cervical cancer. It's the second leading cause of cancer mortality in women. Every year there's about 500,000 cases in the world. 75% occur in developing countries. I do some work in Vietnam every year, and we have the worst cervical cancer cases that I see on a yearly basis when I go there. And in developed countries, cervical cytologic testing, the Pap smear, has decreased the incidence of cervical cancer by approximately 70%. And this is one of my favorite slides, and I've kept it around, and it's from my dad many years ago. And it shows essentially the incidence of cervical cancer from around the 1950s to about the 1980s in British Columbia. So a developed country, a developed area just like Jacksonville, Florida. And what we see is that in 1955, the incidence of cervical cancer per 100,000 women is relatively high. It's about 30. And that's about the rate in developing countries now. Over the years, the incidence of cervical cancer has decreased to about 7 or 8 per 100,000. Let's look at the precursor to cervical cancer, carcinoma in situ. In 1955, well, carcinoma in situ, the incidence is 0, and that's because